concepts right now. When we get into each of the individual muscles, it'll be in the notes there. And then also, the other action that does supination is going to be the biceps, remember? Because if you look at your biceps muscle, you can see how it changes when you pronate and supinate. So again, we're talking about anterior compartment of the forearm. Most of those are going to be flexors. Most of them come from the medial epicondyle. And then here's going to be more of a superficial layer of those muscles, whereas these are going to be a deeper layer. Okay? So sometimes they're referred to the superficial muscles versus deeper layer. So you have a superficial layer and a deeper layer. Okay, so nobody has, you have pronator quadratus?
Yes.
Okay, so first we'll do pronator teres. Nobody has that one? Okay, so that's going to be up here. And I'm not sure if they mentioned this in here or not, but later on when you get into neurology, it will be significant because the median nerve is going to go through part of the pronator teres muscle. So you can have median nerve problems as a result of problems with the pronator teres.
What kind of problem? Say it again.
Nerve compression. The median nerve can get compressed in the pronator teres. And this is a little bit beyond this class, but basically anytime you have nerve symptoms, it's going to be numbness, tingling, weakness, things like that. Okay. Nerve conditions like carpal tunnel syndrome, you can have numbness, tingling, weakness in this area here, which is also median nerve. That just happens farther down. So median nerve here, pronator teres. That's that you don't need to know. We're just getting a little ahead of ourselves, but let's just show the muscle there.
Pronator teres. Along with several other muscles, it arises from the medial epicondyle. In addition, it has a small deep head of origin, which arises from this part of the ulna. Here's the deep head of pronator teres. The median nerve passes between the two heads of pronator teres as it enters the forearm. Pronator teres inserts here, halfway down the lateral surface of the radius. Here's its action. Pronation.
So they did mention about, like I was saying, with the median nerve. And we're not going to get into the fact that it has two heads as far as you just understand if it's the medial epicondyle of the humerus.
And that should say coronoid process of the ulna.
Yeah, so that is that ulnar part. Yeah, so that's not humerus, so we need to fix that. I was just making sure that you were paying attention. It came through for me.
Wait a It's good.
You can be solid there. Okay. You want to see that one again, or should we go on? Ready? Okay. So now, flexor carpi radialis. Okay. So we're talking about muscles that cross the wrist. Okay. So by the name of this muscle, remember when we talked before about the way muscles are named are based on the action that they do, and then what bones they attach to, and then whether, so this tells us that it's going to be a flexor, which means it's on which compartment? Anterior. Okay. So it's going to do flexion. It's going to go across the carpal bones, but now is it going to be more towards this side, or is it going to be more towards this side? Radial side, so that's why it's called radialis. Right? So flexor carpi radialis. And then that's going to, again, like a lot of these, common tendon, flexor tendon of the medial epicondyle of the humerus. And then it's going to go to the base of the second and the third metacarpals. The thumb has its own muscles. Okay? These general flexor muscles of the wrist, they're going to go into the metacarpals, starting with the second. So flexor carpi radialis is going to go into the second and the third metacarpals. Okay? Well, we'll see on here, and then if you still want to go over that. But it's basically right going to be right here. So in this picture, it's showing the second, in the text it says second or third. So it's going to be basically right here. Okay, you have the carpal bones, which are these little small ones here, and then you have metacarpals, which are here. Okay? So let's watch the picture.
The two important ones are flexor carpi radialis and flexor carpi ulnaris. They both arise from the medial epicondyle, where they share a massive tendon of origin, the common flexor tendon, with two other flexor muscles. In addition, flexor carpi ulnaris has an extensive ulnar head, which arises from this border of the ulna.
And we'll talk about the ulnaris in a little bit. Right now we're just focusing on the radialis.
The ulnar nerve, as we'll see, passes between the two heads of flexor carpi ulnaris as it enters the forearm. The two wrist flexors diverge to arrive at the radial and ulnar sides of the wrist. Flexor carpi radialis passes through a deep ligamentous tunnel and ends up inserting on the base of the second metacarpal. Flexor carpi ulnaris inserts on the pisiform bone. From the pisiform, the pull of flexor carpi ulnaris is transmitted to the hamate bone and to the base of the fifth metacarpal by these strong ligaments, the pisohamate and pisometacarpal ligaments. The two wrist flexors, acting together, produce flexion of the wrist. Acting separately, the ulnar and radial flexors contribute to ulnar abduction and radial abduction, respectively. Lying between these two main wrist flexors.
So I realized that in the book, I mean in that video, they're showing that it only goes to the second metacarpal. And in this picture, it shows that it's going in the second metacarpal. But the reason why the notes have that is because it's based on what the textbook has. So there's going to be variations in different books as to find points on origin and insertion. Some may include other things. Okay, so there is sometimes a little bit of a discrepancy, but you can understand it's not that big of a deal. It's basically you know it's going right about here. So if it goes to the second and the third, or just the second. But the idea is that when one of them acts by itself, the flexor carpi radialis is going to do what? Well, if one acts by itself, it's going to tend to pull more on this side. So it can do radial deviation versus if it's the ulnaris, it'll do more ulnar deviation. Okay? If they both act together, it's going to do this. And then after we go through all these muscles, we're going to do palpation stuff so we can palpate these different tendons. Okay? Because a lot of these tendons around the hand and wrist are going to be things that you need to know for point location. Okay? And I've got some slides in there that show the point locations out of the books, and it's going to say, you know, it's right next to the tendon of the yada, 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 right? And then the other one's by this other tendon. So you need to know what these different muscles are and where their tendons are. Great, so. Okay. For carpal tunnel? Okay, what they do there is there's what's called the flexor retinaculum. Like I think you mentioned, like say right, it's right in here, where what he said was, I'll play it again, because when he says the tendons go through this flexor retinaculum, that's where the carpal tunnel is.